Welcome to Annals Animated. Our video will look at an important paper in the Annals of the American Thoracic Society. Here we discuss risk profile of young adults with chronic obstructive pulmonary disease by researchers from Canada. Chronic obstructive pulmonary disease, or COPD, is characterized by airflow limitation causing progressively worsening respiratory symptoms. It is one of the leading causes of hospitalization and the third leading cause of death worldwide. COPD is commonly associated with older age, smoking history, male sex, and low socioeconomic status. However, in recent years, COPD has increasingly been diagnosed in younger adults, prompting exploration of risk factors in this age group. In Canada, for example, about 5% of the population between the ages of 35 and 55 years has been diagnosed with COPD. Some studies have explored specific risk factors such as genetics and occupational exposures, but there was a need to explore a wide array of lifestyle factors and medical history to better understand the risk factors for COPD in younger adults. We will discuss this matched cohort study that used population-based survey data to compare characteristics of people aged 35 to 55 with COPD to non-COPD controls of similar age and smoking status. Several factors were compared between the two groups, namely sociodemographics, for example, sex, rural versus urban place of residence, immigration status, income, level of education, and racial and/or cultural group, health services, for example, comorbidity of health issues, including mental health conditions, lifestyle, for example, alcohol use, fruit and vegetable consumption, physical activity, BMI, overall health status, recent influenza and/or pneumonia, and influenza or flu vaccine status. This analysis was repeated with middle age, or 56 to 65, and older, or greater than 65 years, adults for comparison. 1,094 young adults with COPD were included in the study. Recent influenza and/or pneumonia, history of asthma, and high comorbid conditions were associated with COPD in all age groups. Older adults with COPD were more likely to be male, have other chronic respiratory diseases, lower socioeconomic status, and lower BMI. Notably, COPD in young adults was not associated with sex, low BMI, low socioeconomic status, or non-asthma respiratory condition. Importantly, the presence of mental health conditions was uniquely associated with the development of COPD in younger adults. This is consistent with other literature that noted higher incidence of anxiety and/or depression in younger adults with COPD. The study demonstrates that younger adults with COPD appear to have unique characteristics compared to middle-aged and older adults. More investigation is needed to truly understand the reasons for these differences. But this highlights the need for clinicians to consider that COPD in younger adults may present differently than what is traditionally expected in older adults, and different screening criteria should be considered. Improved ability to identify younger adults at risk for COPD may lead to earlier detection, tailored interventions, and better outcomes. For more details, please read the article by Dr. Andrea S. Gershon and colleagues. Thank you for watching Annals Animated.